Hi, I'm Chad Saley with Comp Health. We're sitting down with Dr. Andrew Wilner, a neurologist and the author of the book, The Locum Life. He's also a regular contributor to the Comp Health blog. And today we're going to be talking a little bit about essential skills for locum tenens physicians. Welcome, Dr. Wilner. We're glad to sit down with you again.
Thanks for having me, Chad.
So to kind of kick things off, there's a ton of requirements that go into just becoming a doctor, like so much stuff that you had to go through. So beyond those, what are the additional kind of skills or requirements that you think are necessary for being a good locum tenens physician?
Well, that's a great question, and it's something as I was writing my book, I started thinking about because part of locums is being the new guy or the new girl at a clinic or a hospital. So I was at a clinic, for example, outside of Boston. I was at a hospital in South Dakota, another hospital. So you have a lot of first days. You remember your first day at work? It's like, whoa, it's a little disorienting, but there are tools and there are tricks, which you learn over time to make it work for you. And so one of the last chapters in the book is strategies for success. And there are things that I learned along the way that can make that first day, which often is the sort of pivot point for the whole rest of the experience. They say, what is it? You only have one chance to make a first impression, right? So you want to make that first impression to be a good one, and that facilitates your whole assignment. So I looked into that a little bit. You don't want to be a hypocritical or, you don't have to be someone other than yourself. But there are simple things that you can do. And there's something called the 3 A's of success. That's something I learned way back when I was a resident. You're going to go into private practice. What do you need to do? So the first A and the most important A is affability. You have to be nice because if you're a jerk, nobody wants to talk to you. And if you're nice, everybody wants to talk to you. So this has nothing to do with your years and years of training, your skill as a surgeon. In the old days, you used to have sort of these temperamental surgeons who just bark out orders and they didn't care whether people liked them or not. And their position was so solid that, it's like, well, we got to put up with him because, he's got such great hands. That in corporate America now doesn't really fly too well. And being nice really is a lot more effective. I've had patients referred to me because I've heard the nurse say, oh, I saw Dr. Wilner with that other patient and he's so nice. I'm going to send my girlfriend to him for her headaches. Now, she doesn't know my skill set. She doesn't know how hard I've studied, the scores on my exams, how many residencies I did. All she knows is that he's a nice guy. And caring, is so important as a physician. It's not just the knowledge and the science. There have been physicians for thousands of years that had basically no knowledge and no science. And yet they were still appreciated because they cared and they tried to help. So that's affability. The next one, availability. You have to show up. If you get a call from a staffing agent, you've asked them, I want to work, in Florida in the wintertime, and you get a call, hey, Dr. Wilner, we got an assignment starts next week, in Fort Myers. Are you interested? It's just what you want. Oh, well, my wife has a big dinner party planned. That doesn't fly. You got to say, oh, yes, I'm already packed. I'll be there. Otherwise, you're not going to get it. And that extends to showing up at work. I used to insist to arrive 2 days ahead of my assignment, even if I had to pay that extra hotel night, because I wanted to get the lay of the land. I wanted to drive to work and back, find out where I'm going to park, where is the gym, where's the restaurant I need to go, where is the laundry, get myself set up in my little hotel room so that when Monday morning came, I was at work at 5 at 8, not 8:15. I was available. I answer my pages right away. Otherwise, oh, that Dr. Wilner, we can never find him. I don't even know if he's here or not. That's not the way to be successful. The way to be successful is, hey, we just paged Dr. Wilner. He always responds right away. So availability is just so important. And then last but not least, but it's always last, is ability. Your training, your knowledge, your ability to make the right decision. But people don't see that. I could work, you know, I could take you and tell them that, this is one of my colleagues, he's a new neurologist, and you could work for months and nobody would know whether you knew what you were doing or not. Because, it's so esoteric what we do. Say, oh, yeah, I think you got Parkinson's disease. Try this for a few weeks, come back. I mean, who would know? So your ability is really hidden. I think it would take months, if not years, for somebody to realize that, gee, I don't think Chad went to medical school. It's your ability doesn't show. It really doesn't show. I mean, your smart colleagues, after a while, will realize, that Dr. Wilner, he did a very thorough exam, and his recommendations are well organized. I think he knows what he's doing. But when you start that new job, nobody knows how able you are. They just assume you passed your exams, you're a doctor, get in there, do what you're supposed to do. So being nice, being available, knowing what you're doing. And if you don't know what you're doing, and that includes knowing how to use the EMR, for example, make it your business to find out. You show up, you got to know what you're doing. And because if you're completely incompetent, it's going to show, and that's going to be the end of that. So you don't really want a bad mark. If you're kind of mediocre, you'll cruise through. But the better you can, the better you are at your job. We talked about that, earlier, that physicians are lifelong learners. You don't graduate from medical school and, hey, I'm a doctor. Okay, I'm good. Whereas, I think some other professions are like that. But physicians, they have to do CME credits, and I'm always reading, always learning. There's always new stuff, and even stuff I know, I want to get to the next level. I want to know it more thoroughly and deeper and broader, and because I don't want anything to slip through my fingers that, gee, oh, I should have known that. That's criminal from my point of view. I want to be state of the art, whatever the state of the art is, to the best of my ability. But I think the 3A's are really, really, and I'll add dress for success. It sounds so simple, but you walk in the door, what do people see? They see how you're dressed, and they judge you on that. If you show up in a suit and sneakers, people notice that. If your hair is a mess or a different color, or you're wearing an earring, that's your personal style, that's okay, but you're going to pay a price. Most patients are still older, and they expect the doctor to have a dress shirt like what I'm wearing, and a tie, and either a sport coat or a white jacket, and reasonable pants. Mine are never pressed, but they're clean, and normal shoes, and nothing too outlandish. If you're a woman, I think the decisions are even harder because you have a lot more options. About how to dress and what you want to wear and what's your style. But people notice that, and if your heels are a little bit too high, or your neckline is a little bit too low, those are the first things that people are going to notice. And I've seen examples of that. So you really have to be intentional. I choose the clothes that I'm going to wear and bring in my suitcase. They're not too exciting for my locums jobs, because I don't want to have to think about it too much. I know whatever I grab out of the suitcase, it's going to be professional. No one's even going to notice. And what did Dr. Wilner wear today? Well, it's probably the same thing he wore yesterday or something pretty similar. But I don't want that to color my performance. And drug reps, right? Drug reps are well known for being well dressed. It's like, they come in, they're always wearing a well-fitting suit. The women are always dressed well. You don't know anything about them or what they know, but gee, that guy, he looks professional. He's really well-dressed. It's an easy thing to do. You don't have to go to medical school. You just have to go and buy some nice clothes. I mean, it's like cheating. I mean, you get points just for dressing. I mean, it doesn't. I mean, why give up those free points? So I think dressing for, on your own time, whatever you want. But until you've been there for 6 months and people know you, just stick with a traditional dress code. It will really help.
So maybe talk a little bit about flexibility, or even I've got another A for you, a fourth A, adaptability, maybe, and how those two things come into play for being a successful locums.
Right. So adaptability is key. And, some physicians are a little more rigid in the way they have to do things, and it should be done this way. And that doesn't really work well, because every time you're in a new environment, every clinic, every hospital, have kind of got their way that things are done. And if you go in and say, your way, that's not right, that's not going to work. So the other thing I should add about, I have a rule. Do not criticize anything at a new assignment until you've been there 1 year. Even if they're asked, gee, Dr. Wilner, how could we improve the flow in the clinic? Oh, I don't know. I'll have to think about it. Even though if it's perfectly obvious that, well, having a nurse take the blood pressure would help, just smile and say, oh, I don't know. It's not your job. Because no matter how much they even need the help and want the help, you're not going to get credit for it. You just will not. I don't know. It's some human nature thing. So you got to go with the flow, which can go, unless you see a patient in peril because they're doing something, unsafe. Just let it go. That's the way they do things here. Fit in, adapt, right? I think that's one of the Marines, adapt and conquer. You got to adapt to whatever the situation is. And if you're a locums person, you're coming into a bad situation because it's a situation that they don't have a permanent person for. Usually, it may be someone on maternity leave or something, but more likely they cannot hire someone for that position because they're not paying enough, or it's in some remote location with too much snow, or there's a disorganization, that's been chronic and people keep coming and going and it's unstable and nobody really wants to put roots down there. So you can't expect it to be the ideal job. If it was, they wouldn't have a locums position. So I always go in with my eyes wide open and very low expectations. And I've always pleasantly surprised that things are better than I thought they were going to be. But yes, you have to just go with the flow, figure it out, get it, read the organization and just do your job, because that's all you have to do. Dr. Wilner, you're supposed to see patients in the clinic. Okay. That's it. Okay. It's like, well, the clinic happens to be 6 blocks from here. Okay. What's the best way to get there? Should I take an Uber, walk, bicycle? Whatever you want. Okay. And just go do it. Figure it out. And they will think you are the greatest doctor ever. Because they've got so many headaches, they don't want to add you to the list of things they got to worry about.
Perfect. Those were really great tips. I appreciate always having these opportunities to sit down and talk with you. So thanks again, Dr. Wilner.
Thank you, Chad. And I'll just add that I wish I had known those tips myself. It took a long time to figure those out. My life would have been a lot easier if I knew them, 30 years ago.
Great. Thank you.
Thanks a lot.